How is NMO different from MS? Understanding spectrum disorders. Imagine two conditions that both affect the nervous system but do so in very different ways. Neuromyelitis optica, or NMO, and multiple sclerosis, or MS, are both autoimmune diseases that target the central nervous system. But they have distinct features that help doctors tell them apart. NMO mainly attacks the optic nerves, which connect the eyes to the brain and the spinal cord. It often causes sudden, severe vision loss and spinal cord problems like weakness or paralysis. MS, on the other hand, can affect any part of the brain, spinal cord, and optic nerves, leading to a wider range of symptoms like numbness, balance issues, or cognitive changes. One key difference is where the damage occurs. In NMO, spinal cord lesions tend to be larger and centrally located, often stretching over 3 or more vertebral segments. These are called longitudinally extensive transverse myelitis. MS lesions are usually smaller, more scattered, and rarely extend beyond 1 vertebral segment. This difference is visible on MRI scans and helps doctors distinguish between the two. Optic neuritis, or inflammation of the optic nerve, is common in both conditions. But in NMO, it tends to be more severe, often causing significant vision loss and retinal nerve fiber layer thinning. Microcystic macular edema, a swelling in the retina, is also more common in NMO. MS-related optic neuritis is usually less intense but can still cause temporary vision problems. The disease course also varies. MS often follows a relapsing remitting pattern, with episodes of symptoms followed by periods of recovery. Over time, some people develop secondary progressive MS, where symptoms gradually worsen. NMO tends to have recurrent attacks with less remission, and the damage can accumulate quickly if not properly managed. A crucial diagnostic difference is the presence of aquaporin for antibodies. These are specific proteins found in the blood of most people with NMO. They help identify NMO and distinguish it from MS, which usually does not have these antibodies. Blood tests and MRI scans are essential tools for accurate diagnosis. Treatment strategies also differ because the underlying causes are not exactly the same. Both conditions involve immune system activity, but therapies are tailored to target specific immune responses. Proper diagnosis ensures patients receive the most effective treatments and avoid therapies that might not be suitable for their condition. Understanding these differences is vital for healthcare providers and patients alike. Accurate diagnosis leads to better management, reduces the risk of unnecessary treatments, and helps in planning long-term care. If you or someone you know experiences symptoms like vision loss, weakness, or numbness, consulting a healthcare professional is the best step. Remember, each person's experience is unique, and medical guidance is key to navigating these complex disorders safely.